It's my feel-good breakfast show.
A very warm welcome, you early risers, to your feel-good breakfast show on this Monday morning. It's Expresso Live, large and in charge. And thank you very much for starting the week off with us. Now, a primary immunodeficiency disorder comprises the immune system and prevents the body from fighting off any infection or disease. And during this time of COVID-19, a strong immune system is critical. It's key, and those who suffer from any immunodeficiency diseases could be at an increased risk. Now, the annual World Primary Immunodeficiency Week has this year been extended to 10 weeks from the 22nd of April to the 1st of July to raise awareness for those living with any of these diseases. And Professor Claudia Gray, Paediatric Allergy Specialist at the Red Cross Children's Hospital and UCT Lung Institute, joins us this morning to tell us a bit more about the link between PID and COVID-19. Professor Gray, thank you very much for spending some time with us this morning.
That's a pleasure. Thank you for the invite.
So let's start off first by trying to understand exactly what are primary immunodeficiency diseases.
Right. So an immunodeficiency essentially is a problem or a dysfunction with the immune system. We are all born with an immune system that fights infections primarily, and it has many different parts to it, as you can imagine. Some people are born with one or more parts of the immune system not working optimally. So they're dysfunctional, which makes them less able to fight infections well or quickly or efficiently. And this is termed a primary immunodeficiency, and it's normally a genetic defect. So it's a defect in the genes that code for our immune proteins. Now, contrast this to a secondary immune deficiency, which is an immune system which becomes faulty over time because of disease such as HIV or heavy medications such as prolonged steroids. But at the moment, we're talking about the primary immunodeficiencies, which people are essentially born with. Sometimes, however, they are not recognized that early in life. And we even have some adults presenting or diagnosed for the first time with a primary immunodeficiency, which they've had all their lives.
What are some of those first signs and symptoms of a primary immunodeficiency disorder?
Yeah, so this is sometimes quite tricky because especially in younger children, you know, if anyone out there has young kids, you know that they're often constantly sick and snuffly. And in young children, in fact, up to 10 to 12 mild infections such as colds or a little bit of an ear infection, tonsillitis, is still within normal range. But for primary immune deficiencies, these infections are just a little bit more onerous than they should be, or sometimes they're full-blown life-threatening. So we use the acronym SPUR, S-P-U-R, to remind us of which patients might well have a primary immunodeficiency. The S stands for severe. So infections are just more severe than average. The P stands for persistent. So it takes longer to fight infections. The U stands for unusual. So really weird infections sometimes. And the R stands for recurrent. So instead of getting 2 ear infections a year, someone with an immune deficiency may get 8 ear infections a year, or sinus or recurrent pneumonia, for example.
I mean, as I said earlier on, we are focusing on the link between PID and COVID-19. So are people with immunodeficiency disorders at a greater and increased risk of more severe COVID-19 experience and a prolonged and disease if it's contracted?
Sure. So the first thing to say is that we know that COVID-19 is a new entity and we don't know everything about it yet. As you can see, news is evolving every day. So we don't have hard figures, but common sense would prevail and say that yes, people with a defective immune system, especially those who are poorly controlled or have complications such as severe lung disease, are probably at risk of greater complications of COVID-19. So they may well get more chest complications, for example. The statistics are not there yet, but common sense would prevail, and we certainly are advising our immunodeficiency patients to take extra care.
Let's talk a little bit more about that, some of the preventative measures that people with primary immunodeficiency disorders can take in order to prevent themselves from contracting the novel coronavirus.
Yeah, sure. So the first thing is to reassure them that if they carry on with their regular treatment and are fairly under control, they will likely have a risk that is reduced to similar to that of the general population. So it's all about being prepared and knowing what symptoms to look out for and being on one's chronic medications. So clearly, number one, they should take the general precautions, which our government has really set out so well, wearing masks in public, frequent hand washing, hand sanitizing, social distancing, especially important. So they might be the last group of people, for example, going back to school if they're in a severe category. Secondary, very importantly, carry on seeing your doctor. Don't shy away. Get your medications. Carry on with every single medication that controls you, even if it is an immune suppressant. Keep your immune condition under control. Extremely important. Thirdly, if you are feeling sick, rather go to your specialist if possible, because they know you the best. And if you do go to a doctor, take your medical history along. Take all your medications along so that they can see. So essentially, it's all about being prepared and staying in tip-top shape and on your regular medications.
Great advice there. Thank you very much, Professor Gray.
Absolute pleasure. Thanks very much.
Our thanks to Professor Claudia Gray for joining us this morning to tell us a bit more about the link between primary immunodeficiency diseases and the coronavirus. And of course, as the COVID-19 infections continue to rise in South Africa, let us all continue to do our part in flattening the curve by social distancing and staying at home during this national lockdown.